Satisfy your need for happiness through your own curiosity with the Ranveer Show.
So let's say you came to me with chest pain, right?
Yeah.
We took you to the lab. So how would this happen? You come in with chest pain. They diagnose you with a heart attack. The next step is, if you have the ability, you would go to the cath lab potentially, which is a lab which has a big radiology meter, and then they put a catheter in, and with dye they map out your heart arteries, right? And where the blockages are, if it's one or two arteries like we were talking about, you could potentially stent them if they're in the right locations, right? In cases where you have three vessel disease or left main disease, there's three major vessels on the heart. If all three were affected, then putting in stents in them is A, risky, but B, also doesn't carry the long-term benefits that heart surgery does.
So either you replace some of the pipes, or if it's a more extreme situation.
So you don't replace them, right? What you're doing is
opening
them up and putting a scaffold in.
Sure.
But the problem is that scaffold can have closure with time, and more often with stents, right?
Gotcha.
Now, let's say you're not a candidate for stents, then you would refer someone to a surgeon. And what the surgeon would do typically is, through an incision in the middle of the chest, they would either do it off pump or on pump. So off pump means that we would stabilize your heart. We would take a conduit, which is a piece of pipe. Either what it means is you take a vein, you reverse it, and you hook it up to the big vessel coming off the heart, and then you hook it up to the artery beyond the blockage.
Hold on. To place a stent, you don't need a surgery?
You do, but it's only a needle stick.
That's it?
Yes.
Okay. And the open heart surgery is more serious?
It's more involved, right? The recovery time is longer, whatnot. But the long-term patency and durability of it is higher, right? And so in the select patients, in the right patients, it's the appropriate thing. If you just have one or two vessels that are easily stentable, they can stent them, knowing that you may have to revisit it in 3 years, 5 years. You modify the risk factors, and honestly, it's less of a do than doing an open heart. But in the cases where it's substantial disease in a diabetic or something like that, heart surgery would be a better option, because long term the durability of that would be higher.
And what do you do in a heart surgery? You said you stabilize the heart.
Yeah, so after putting the patient to sleep, right, you would take artery from the inside of the chest, called a left internal mammary or a right internal mammary, which you leave intact up here, and you clip the end of it. And normally that works with the intercostal arteries to basically provide blood flow to your ribs and to the tissue in between. And it won't miss it because you have collateral or other circulation to that area. And then you also take veins from the leg, called the greater saphenous vein, which is a superficial vein that's easily accessed. Or you can take radial arteries from the hand, which are small arteries in the hand. And you have two arteries in your hand, the radial and the ulnar artery. And if you take the radial artery, so long as you've done your testing to make sure that the flow is okay with just the ulnar, it can work as a conduit. A conduit meaning a pipe, basically. So in the case of the mammaries, this is intact. And now the patient's asleep. You've opened up their chest. You've put the heart on a retractor. And then there's two ways you can do it. In one case, if you can do it off pump, what it means is you don't arrest the heart. You don't stop it. Instead, what you do is you position the patient in a way that the blood flow is not compromised. And you put a suction retractor on it called an octopus or whichever brand you want to use. And it basically picks up and shows you the artery. And then what you do is you cut a small hole in the artery. And the nice thing with the coronary arteries is they're all on the outside of the heart. Unlike, the big arteries, which are pumping, the flow to the heart is actually on the outside of the heart. They made it convenient so that we could access it if we needed to, right? And so we open up the artery and we put in either a flow stent, which is a small temporary pipe, so that blood goes beyond. And then we bypass that area. And as we finish the bypass, we pull that out. And generally, if you're using the mammary, the flow is going to be on right away because we just put a temporary clip on it, a little alligator clip. And then once we're done with that, we de-air it and then we turn on the blood flow again. With the veins from the legs or the radial artery, oftentimes we will hook it up to the aorta first and then measure it out the distance because it stretches and it has to be exactly right to, bridge the gap. And then we do the same thing and we position it. Are there places where it's hard to do it? Yeah, on the back of the heart, it's really challenging because you have to twist it around. And there, sometimes you have to go on pump. But there's a huge art to it. And that wasn't the only thing we did as heart surgeons. We replaced valves. I did a lot of aortic surgery, both open and endovascular. We did robotic surgery. I could do a one vessel through the robot through a minimal incision. So we did minimally invasive stuff. We also did lung surgery. So a lot of things going on with heart surgery. And it's advanced a lot. But at the end of the day, my thought was 2 to 3 patients a day. I would say if we can prevent, early recognize, early treat, we're going to be at a much better likelihood of saving lives. And it doesn't mean that the number of heart surgeries will go down. In fact, it may actually go up because we're recognizing it earlier. It's just that people won't have complications. And long term, they'll have better lives and lifestyles. So is that enough?
Whoa. Okay. To summarize heart surgery, basically some part of the heart is damaged. If it's a pipe, you replace it with a pipe from another part of the body.
Yeah, and not damaged. The damage comes once the pipe's blocked.
Blocked.
Yeah. And so the idea is you got to get blood flow back. But now if it's narrow and for all intents purposes, when you work out, you're getting chest pain, I need to give you better blood flow. If it's in 3 vessels, or it's in a left main, or it's in an area they can't stent, you would bypass them, or in a diabetic. In other cases, you could stent them, knowing that with heart surgery, it's usually more durable, meaning in a 10-year period, less likelihood of having another intervention. But nothing lasts forever. So with all of that, we have to manage. And so that comes under the category of secondary prevention. We were talking about cholesterol, right? Primary prevention is sort of out, meaning that just because you have high cholesterol, I'm not going to dump a bunch of drugs into you. But if you have risk factors for disease, like a first degree relative, all that is a person I would intervene on. Now, secondary prevention is after you've had the heart attack. I already know you've got the cholesterol and I need to prevent you from having another heart attack and for these arteries to stay open. So in that patient, you are going to maximally reduce cholesterol and do all the other interventions, put them on a cardiac rehab protocol, get them to, respect their bodies, no smoking, be, very smart about how you live, what you eat, and try to de-stress, right? And if you can manage those risk factors, the long term is very bright, knowing that this disease is insidious. It's a lifetime thing. We need to take it from an acute occurrence to a chronic thing that we treat for a lifetime. And with that, people do live very, very well, right?
My chest hurts.
That wasn't what it was meant to be. In fact, it was supposed to put you in a position of power. Knowledge is power. If you know about it, we'll be able to sit there and prevent it, right? And the idea is to intervene early and often before you get into trouble. That's the whole mission now.
If you enjoyed today's clip, make sure you check out these curated playlists that we've made especially for you related to the subject that was spoken about in this clip.